This lecture will cover the trematodes, which are the flukes. So they are, first we'll look at the intestinal trematodes. So they are flukes, which are dorsoventrically flattened parasite. And so they do require at least one intermediate host, and this is usually a freshwater snail. And most of them are hermaphroditic. So the adult worms will reside in the small intestines, and then the eggs are actually shed in the feces. And so with these, the adult worm, as far as the life cycle, the feces is, it can reach the water supply, and then from there it will penetrate the snail, and then it develops inside of the snails, and then it will emerge from the freshwater snail, and then from there they can be deposited on vegetation or within fish, and then then from there it is ingested by the human, and it becomes the adult worm within the human, and then those eggs can be redeposited into the feces, and the cycle starts all over again. The Coelopsis busci is found in the southeastern Asian countries, and so this infection comes after ingestion of raw water chestnuts. The dependent host is pigs, and then the reservoir host would be fish-eating mammals. So it could contaminate the water supply when feces is used for fertilization. And so from there, the egg can be ingested, the adult worm will attach to the intestine and causes abdominal pain, diarrhea, GI obstruction, edema, malabsorption of vitamin B12, which of course can cause the macrocytic anemia. It can also cause the eosinophilia, where you have the increased eosinophils, and then it will be diagnosed based on those eggs that would be deposited in the feces. And so here is the picture of the egg and the fluke itself. And so you can see it's kind of like a flat type looking organism here in the center, and this would be like its mouth. And then the eggs, of course, they look, pretty large eggs here. This would be the top of it, where the organism would actually come out when it's mature. But you can see that a lot of these eggs are starting to look the same. And so this chart just kind of gives a little bit more detail as far as the organism and its appearance of that egg. With the liver fluke, these organisms the adult organism will live in the biliary ducts, and of course they are infect the host through freshwater snails, and we'll discuss 3 of the more common pathogenic organisms. So with these organisms, they can infect from that freshwater snail. They can then go into dogs, pigs, rabbits, and the infection can happen because of the feces that contaminates the water. And then the eggs will enter into the snail and then develop from there. So again, here just kind of goes through that life cycle in which it reaches the state to the point where it will infect the human through ingestion, and then the feces will go back into a contamination type supply, and it will just keep circling back. With Clonorchis sinensis and Opsithoreus viverrini, these organisms are very similar. They usually cause a light infection that's asymptomatic. If it's a heavy infection, it can cause fever, abdominal pain, jaundice, and then of course more severe infections, because it is a liver fluke, can cause biliary obstruction. And the fasciola, this can cause a light infection as well, with fever, abdominal pain, diarrhea, jaundice, and tenderness of the liver. And then these organisms can actually migrate to the intestinal walls, lungs, brain, heart. So with a clonorsis infection, you've got an egg that has a shouldered orpicula. And so with this, you're looking at where it kind of has like these little bumps on the edges where this little cap right here will pop open and the organism will come out. And then at the opposite end, you will have a short little knobby tail on it. So they will look kind of yellow-brown in a wet mount. And with the actual fluke itself, which it's not very common that this would be used for diagnosis, but here is an image of that fluke itself. And again, the Opsioscorsis will look very similar to the previous. They're a little bit harder to differentiate between the two, so they kind of Clonorchus is usually what it's going to be referred to. It is a little bit smaller, but they do look very very similar. Fasciola, the adult worm is very large for a fluke. With the eggs, it does not have those little protrusions around here with the orbiculum. They do give a brownish red color, and you don't have that little knob on the end either. Paragonimus species, this fluke will live in the lungs and produce eggs that can be found in the sputum and feces. So this is a lung fluke, and it is the most common one. The intermediate host would be the freshwater snail, and then next would be the crab or the crayfish, and then from there, depending on the organism, could be dogs or cats and pigs. So with Paragonimus westmani, which is your most common one, the disease will be a very light infection, being asymptomatic. However, if you do have the metasaccharida that migrate, they can cause tissue damage, and then it will become encapsulated to form a granuloma, and then this will actually cause a chronic cough. And so with this organism, it'll cause the chronic fibrotic disease that will resemble tuberculosis. So you get that cough and the blood-tinged sputum. But what you'd be looking for was that organism or that egg within that sputum sample. So it's a brownish yellow type organism, and it does have an apiculated shoulder area of that egg when it's isolated from the sputum, and that's what you're looking for. You can see those lesions on the x-rays of the lungs, but you can also do some more automated testing to help detect this organism. So here you have that egg for the Paragonimus westmani, and you can see again this little orbiculum that will pop open to allow that organism to come out. And we will see a side-by-side comparison of these. The blood flutes that we will discuss that primarily infect humans is the schistosomias, and so we'll go into each of those in more detail. So with all of these, the adult schistosomes are not as flattened as some of the others. They do have an oral sucker that surrounds the mouth, and they also have a ventricle sucker that is below the oral sucker. The male is a little bit shorter in length and wider than the female, whereas the female is a little bit longer but very thin. The adult worms live in the veins that supply the blood supply to the intestines and the bladder, and then the eggs are passed in the feces or the urine. And so you're looking at the spine of this egg for identification. And so the life cycle, once the eggs are in the feces or the urine, they're passed into the water, and then from there they penetrate the snail, and then they emerge from the snail, penetrate the skin of the human, and there they will move towards the blood or the veins. And so what they do is they actually cause a localized swelling and itching. The migration can cause fever, a tired weakness, severe lung tissue damage once those eggs penetrate the tissue and they reach the intestines or the bladder. And so the blood flukes are commonly infect the mammals, and they can cause swimmer's itch within humans. Eggs are detected in the feces or through biopsy, so this could be like a rectal biopsy. It can be found in the urine or the blood. So you could look at these with wet mount, with or without any sort of iodine stain. And trying to recover the schistosoma hematobium, that's going to be recovered in the urine, usually like midday is the optimal recovery time. And there are some assays that can be done to help detect these organisms, some antibody type assays, PCR testing. The schistosoma hematobium, this is more predominantly found within Africa or Arabian Peninsula. So with this organism, the adults, when it affects adults, it goes into the bladder, rectum, and the eggs are caught up in the tissue, and so it can cause issues with the bladder, urinary system, bladder colic with blood, pus, nephrotic syndrome. The symptoms can be mild, and it can also have pulmonary involvement with the eggs reaching the lungs. And it has been associated with cancer of the bladder. And so diagnosing this is based off finding eggs in the urine, occasionally but very rarely within the feces. Schistosoma mansoni. So this organism is also found in Africa, Arabian Peninsula, Brazil. And so with this organism, it can be associated with rodents and the marsupials. And so this one is more commonly known as a blood fluke. And with this one, this organism can cause granulomas that form around the egg, and so this can happen within the liver, intestines, bladder, and it can also cause a toxic allergic type reaction, nephrotic syndrome, and of course diagnosis of this is based off the eggs itself. Schistosoma japonicum, this one's found in China, Indonesia, Philippines, and this one can be found in domestic animals. This is also known as the Oriental blood fluke. And with this organism, the symptoms are very similar to the Mansoni. They can be a little bit more severe with greater egg production. And so again, you're looking for those eggs that can be present in the urine or feces, anywhere really throughout the body. So where they can be found as far as the location of the actual adult fluke, the blood fluke. So it can, depending on the organism, be found in the bladder, in the small intestines, or in the large intestines. And so they're differentiated by how the egg actually looks and where the location is of the spine. And so I'll explain that a little bit more in the next pictures. And what we're looking for when I'll talk about that spine, of course they are a little bit different in size, but you're looking for this little appendage that sticks out from them. So with your Mansoni, this one has this little lateral spine, so it's on the lateral side of it, and so it is a larger one, whereas with your Japonicum, this one is a smaller lateral spine, and the egg itself is not as elongated as the Mansoni. And then with your Hematobium, this one has a terminal spine, and so you can see that it's at the large terminal spine that's at the end of the elongated egg of the schistosoma. And so this kind of just compares them all as far as like a more overview of a visual. Of course, these two are not ones that we are studying, but you can see that the terminal spine versus those lateral spines, and you can see the difference in size of those lateral spines, and as well as the shape of the egg itself. So it just gives you a better appearance of those eggs in comparison. And so here you have a chart that just kind of gives you an overview of all of these that we've discussed, all these trematodes, and the differentiation of them based on size and shape of each of those eggs.